Okay, what I'm going to talk about here is the responsibility of the nurse to do a daily check of the code blue card and the defibrillator. Now, it depends on the unit that you may be working in. Our hospital policy says that that check has to be done every 24 hours, but your unit may institute an every 12-hour or every shift check. So follow whatever your institution's standards are. One of the first things you have to do when you come to the cart, number one, is take a quick look at the defibrillator to make sure that you see that the charge light battery light is on. That's extremely important. Instances have occurred where the defibrillator battery has run down because people did not notice that it was not plugged into the wall outlet. The next thing that you would do is, of course, get your book or paperwork, whatever you happen to be using, and look for your daily check sheet. And this is what you'll be documenting on. And of course, this is an extremely important part of the recording process. Date, time, your initials, of course. Now, there's usually a crash cart number somewhere on the cart so that the cart can be identified. You'll see here on this particular cart, it's number 35. In addition, there will be a plastic lock of some sort attached to the outside that makes sure that the integrity of the system is intact. And there's a number on the plasticized lock that you would also record on your sheet that says lock number and that the lock is intact. The other thing that you'll be looking at is whether there are any medications or equipment that are due to expire that are sitting within the cart. And on this particular cart, they put that in a little pocket on the outside that's very readily seen. So you need to document the date that the next medication or piece of equipment is ready to expire, and then of course you'll be signing your name and your initials. And that's basically it as far as the actual paperwork. Now that consists of the integrity of the cart. You're making sure that the cart has not been tampered with or opened. The next thing that you're going to be looking at is the defibrillator itself. You'll be testing the integrity, the functioning of the defibrillator. As I mentioned before, you want to make sure that you have power. The next thing that you'll be doing is simply 1, 2, 3, and that is following the instructions. Most defibrillators these days have very simple, explicit instructions on the front of the defibrillator that tells you exactly what you need to do, and it's almost as if you were doing an actual defibrillation itself. The big difference here is that you'll be putting it into a test mode, and you'll only be using a minimal amount of energy in order to save the integrity of the inner workings of the defibrillator. So, remember, with CPR, remember your ABCs and your 1, 2, 3s, just like you learned in kindergarten, okay? So, we're going to test the defibrillator itself. One issue that people seem to have sometimes is they turn it on and they leave it at monitor. We're not testing the monitor, we want to test the defibrillator, so actually turn it all the way over to 1. You'll hear beeps, and you may even hear a voice prompt of some kind. However, just ignore that at the moment. What you're going to do is take the multifunction cable, disconnect it from the pads that may already be sitting in wait for patient use, disconnect that. You'll notice that there is a zigzag arrow on here that kind of refers to electricity. You take that arrow and you